Hi, I'm Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation, and we are back with our video edition of 5 questions. I'm here today with Laurens Ceulemans of University Hospitals Leuven. Good afternoon, Laurens.
Hello, Jess. Good afternoon. Very nice meeting you.
Nice to meet you too. And before we dive into our 5 questions, let's start with the basics. Would you tell us who you are, where you work, and what your role is in ISHLT?
Perfect. Thank you very much for the opportunity. So my name is Laurens Ceulemans. I'm a thoracic surgeon and transplant surgeon at the University Hospitals in Leuven, and I'm appointed as a professor at the Catholic University of Leuven, where I do basic research in the lab of respiratory diseases and thoracic surgery.
Fantastic. Well, tell us a little bit about why you first got involved in ISHLT and what keeps you involved in the society.
So IshLT is, of course, one of the most, probably the most important society for professionals involved in heart and lung transplantation or lung failure. Since Leuven is one of the largest lung transplants worldwide, with more than 70 lung transplants each year, working here, of course, gives you a certain responsibility to keep up to date to the scientific knowledge and to stay in contact with your international colleagues. And that's, of course, working here that makes you feel responsible, and being associated to such a society is a big added value for me as a person, but also for the whole hospital, of course.
Absolutely. Would you tell us a little bit about what inspired your career path? How did you start doing what you do?
It started quite early, I must say. The first day I was an intern, a surgical intern. It was Professor Van Raamdonk, who is the surgical director of our lung transplant program. It's no more than 12 years ago. He will not remember it, but I remember it very well. He came up to the office and asked, is there anyone who can help me with lung procurement? And I stood up and said, yes, of course, lung procurement. I had no idea what it was, but I stood up and I joined him. I remember that we went by car, 2-hour drive, and that we were there. I assisted him, that we came back and did the transplant. And from that moment, I knew it. I knew that my heart was in transplantation, and that I had to follow this feeling. And then I must say everything went on. And then 2 years later, I had the opportunity to start a PhD, basic research in the field of intestinal transplantation, which is quite a similar organ because it's also exposed to the environment, and you have a lot of difficult immunological challenges, which are the same in lung. And from the moment that you grasp this feeling of being on the edge of a field that's ever evolving with colleagues who are mutually interested, then it grasps you and you get passionate. And then I got the possibility to continue until the moment that I'm now actually a transplant surgeon and doing what I wanted to do already 12 years ago. That's how my career evolved. It was like following my feeling and my heart. And that's why we're here today.
That's wonderful, and all because you stood up to volunteer for something that you didn't even really know what it was.
Yes, absolutely. Yeah.
So do you have a meaningful milestone either in your career or in the field in general that you'd like to share or talk about?
There are definitely quite some milestones. For me personally, I must say the whole COVID-19 pandemic is a major milestone, has posed a major challenge on transplant programs worldwide, and especially on lung transplantation. There are still so many unsolved questions right now. And being involved in lung transplantation puts you also responsible to answer these questions. And I must say, during the last year, we were involved in the first lung transplant of a donor who had been infected with COVID, who had COVID-19 3 months before, and then we were challenged by the question: can we use these lungs for transplant? Which is actually a very important question, since more and more donors will have been infected by the virus over time. So this is a question that has to be answered, and we did a successful transplant. And from that moment, I was intrigued with the whole respiratory infection and the effect on transplantation and immunity. And from there on, a lot of research questions came up. So for me, that was a major milestone last year. It's also something that we didn't experience in the 30 years that our program exists in Leuven. This is the first time that and it's not only Leuven, it's the whole world that is challenged so much. For me, it's quite a recent milestone, but it will have a lasting impact for the rest of my career, I'm quite sure.
Definitely. So that segues really nicely into my next question, which is, when you think about the future of your specialty, what do you see on the horizon?
I see a specialty, transplantation, which is still quite young in comparison to other surgical specialties. So it's a field that's enormously evolving because there's a lot of scientific input, scientific challenges that need to be answered. But I see on the horizon that we have to face the same challenges as always, and that first is the donor limitation. So we are always lacking organs, suitable organs for our patients. Second major challenge is the immunological question and the risk of rejection and chronic rejection, because still half of our patients, after 10 years, they will have some kind of chronic rejection. So these challenges need to be solved. And I think for myself, I see definitely a future for genetic manipulation, genetic modulation of organ grafts. This can be either done by xenotransplantation, solving the challenge of the limited organ availability, and then also masking the allograft, masking the lung towards the immune system of the recipient, so that it becomes from non-self, that it can become self, and that you avoid the whole problem of rejection. And I see there definitely with the evolution over the last decades in CRISPR, in CRISPR methodology for genetic manipulation and modulation, I definitely see the future there. Yeah.
So when you're not grappling with long-term questions for the specialty, like dealing with long-term implications of COVID and rejection, what's your idea of a perfect weekend? What do you do when you're not saving lives?
That's a good question. So the perfect weekend for me is spending time with my family. I have a lovely wife who is also a surgeon and quite busy, and two lovely daughters, Heloise and Florence. They are now 4 and 5.5. They love their father a lot, but don't see me that much during the week. So weekends are really special for me. And the perfect weekend would be a weekend with my family by the seaside, enjoying time together. And then by the end of the weekend being called for lung transplant, because that's also my passion, and I try to divide my passion between family and lung transplantation. And these two things make my weekend, definitely.
That's a great answer. Well, thank you so much for taking time to chat with me today. This has been fantastic, and I'm so excited to see what you do next in lung transplantation and for the IshLT. Thank you.
Thank you. I look forward. Thank you very much for the opportunity, Jess. It was nice talking to you.